Hi, I'm Dr. Rajani. Thanks for joining me today on this all-important video on the COVID-19 vaccines causing facial filler problems or swelling. You may have already heard about it. The news was out last week and we're trying to decipher what it means for you. Are you thinking about getting fillers in the future and in the new year like many people? Or have you already had them, they're placed in your face and you're a little bit worried? I'm going to answer 5 of the most commonly asked questions over the past week on this channel and also on my other social media platforms. The first and most common question I get asked is, what is it all about? Is it real? Does the vaccine cause facial swelling where the fillers were placed? Number 2, what areas does it occur in? So is it the lips, the cheeks, the preauricular area? Is it the forehead? Where is it occurring if indeed it's happening? And number 3, should I get the vaccine? So if you've already had facial fillers, is it okay to get the vaccine? And the flip side, number 4, should I get fillers? Meaning, should you still go get fillers if you're planning to get the vaccine? And just under 50% of the country at this point, I believe, say they do want to get the vaccine. Lastly, what fillers are implicated? Remember, if we say a filler, what is a filler? There's different types. This is going to be a fairly succinct video, but I do have to dive into what filler types because there are different ones. Not all of them might behave the same in the face. Okay, let's dive into this. I got my Rajani coffee on the go, but if you find value in these videos, remember, like and subscribe. We're all about educating, keeping you up on the latest information of minimally invasive advanced aesthetic procedures to help you decide what's right for you, save you time and money. So, something a bit unexpected to add to the possible COVID vaccine side effect watch list, as we say, a watch list, which is facial swelling in people who've had dermal fillers. So the presenting agency's analysis of the Moderna data reported, here we go, 2 people developed facial swelling after vaccination. Now both had a prior history of getting cosmetic injections or dermal fillers in their cheeks. So we have 2 for the cheeks. Then one person had undergone the procedure 2 weeks before being vaccinated. So 2 weeks prior. The second person had most recently had dermal fillers about 6 months. Now that can be a little bit alarming to people because they're saying, well, yeah, I had them a year, 2, 3 ago. We know they last a lot longer than the 6 months or 12 months. Some of them are approved for 2 years. If you take something like Belafil, we're going to dive into which ones. That's much longer term, has approval for 5 years. But yes, 6 months out, of course, the dermal filler is still there. Now look at this. A third person in the vaccine arm had swelling and angioedema, as they call it. Angioedema is the swelling just underneath the skin, is associated to hives or something above it, depending how it's mediated. 2 days after vaccination, this person had received prior dermal filler injections in the lip. Now we don't have a time frame here. Interestingly, that subject reported similar reaction after a previous influenza vaccine, however. So you see, I'm going to come to a common denominator as to why this might be occurring, but something similar did occur after a different vaccine. In all 3 cases, the swelling was localized and it resolved after treatment with antihistamine or steroids. The FDA team did a literature review and did find earlier reports where people with dermal filler injections reacted with temporary swelling to vaccinations. And there's a reason we'll get into really quickly. But here's the thing. We're planning to note this in the prescribing information. So it will be in there in one form or another. Okay, so that's what the study showed. What does it mean for you? Well, if you look at it, there were 30,000 people in that trial. 3 had a filler reaction. If you extrapolate how many people would maybe have had fillers in total of the 30,000, we would go back and look at, say, 2.6 million people had procedures, filler procedures in the United States in 2016. And if we extrapolate that through, there would be maybe 240 people that would have had filler in the trial, but it's way more complex because you got to figure out where the people in the trial were from. We have some data from this map here, and there's further demographics here, but you can see a high percentage were male, and the filler injections would be much more common in female. So to take it and say that what's the statistical probability that this is happening in filler, and then of course what type of filler, which we're going to talk about, it's almost impossible to say what it is. But if you, and I played with the numbers a little bit, it's not insignificant given likely how many people in that trial actually had fillers in their face. So let's dive into what type of filler. Now, they say filler, we don't know what type. Certainly lip filler, the most commonly used, and actually in the whole face, is going to be hyaluronic acid filler, bacterial cross-link filler. Around the world, there's hundreds. In the United States, there's several different types, but they have a common denominator. We don't know what specific brand, but there are major brand differences, and some tend to be more sensitive to the body's immune system than others, and we're going to talk about that. But it's likely these dissolvable hyaluronic acid fillers, but keep in mind, they're not all created equal, and we also have PLLA, poly-L-lactic acid, the L-isomer lactic acid, known as Sculptra in this country, in the United States and Canada, and in many countries in Europe, but there are other forms of PLLA, and people call them filler. A lot of us call them more biostimulators. The next common type is PMMA, or known as Bellafill now. It was Artefill. Those are the same construction, collagen plus 50 micron PMMA beads. Before that, which you don't see anymore, was Articol and Arteplast. They were predecessors that had different size molecules. And then calcium hydroxylapatite, or Radius, is also common. And that is calcium, as the name implies. It's very commonly used. We don't use commonly, most people don't, calcium, Bellafill, or PLLA in the lip region. So more than likely that would be hyaluronic acid, but we're not sure. People do use silicone. They use other particles and permanent products in the lips. Certainly some fillers would be much more susceptible to a longer term immune response, but because they resolve with antihistamine and steroids, we're betting on hyaluronic acid fillers, the most common, the most frequently used for those areas for many reasons, but among them are they're dissolvable. So if patients don't like them, they're not happy, or they do have immune problems, you can get rid of them. Okay, so I'm going to answer those questions that we asked at the beginning. But there's one more piece of the puzzle you're going to need to know what you should be doing. And that is, why would this occur with a vaccine? Why is the immune system amped up, and does it make sense? Let's just see what this is all about, because the new vaccines aren't like they were made traditionally. These are new, novel mRNA vaccines. So vaccines prepare the immune system of the body, and they get it ready to fight disease-causing organisms, and these are called pathogens. The vaccine is introduced in the body. It mimics infection to some degree. You don't really get the full illness. Conventional vaccines have traditionally used a weakened or inactivated pathogen, or a piece of it called an antigen. The RNA, the new ones, however, are a new generation of vaccines, and they can be produced, as we've seen, rather quickly. Instead of the antigen itself, the RNA contains a messenger, or mRNA, that signals the body to produce proteins. This protein acts as the antigen, and once inside the body cells, the RNA can then tell the cell to replicate these proteins. The antigen is then placed on the cell surface, and when we get exposed to the real virus, the body recognizes it and fights it off. And that's what's happening here. The body is amped up, and you get a hyperimmune response. And of course, fillers, to one degree or another, are foreign bodies. Of course, some are seen as a more important foreign body, or get more of a reaction per se than other fillers. And we don't know in this case which fillers were implicated, if it was one class, one brand, but a lot of people have different theories on that based from what we see reactions in real life. Because if you think about it, you're running around, you might have a hyperimmune system for one of a number of reasons. And it's why people with autoimmune disorders, which have a heightened level of immunity anyway, sometimes we're a little cautious of what we do with those patients because of it. Are they going to attack that product? If it's a non-dissolvable product, we get a little more concerned because we can't just get rid of it from the body. With the dissolvable products, however, hyaluronidase, we use it all the time, and you can get rid of the filler if you want to, and it naturally degrades over time. But like I said prior, even though hyaluronic acids are approved for one to 2 years, they often last a lot longer. Okay, so let's answer those questions, starting with what we first asked. Is it real? It's absolutely real. There's the data. The mechanism we also talked about, and I think that's an important part of it. Which vaccines? That was the Moderna vaccine that's going to be somehow on the label, as they said. I train a lot of people around the country, around the world, and people ask me and send me cases all the time. I have had a couple from the BioNTech, Pfizer, FILLER, if you're German, vaccine. And so I think it will be all vaccines. And you saw in that report from Moderna, one of the patients had a reaction with the flu vaccine. So it's about the immune response. The good part about this is they're likely hyaluronic acid fillers that are implicated at this point, because we know there was a lip filler in there as well, and there was angioedema in that one case. And these are dissolvable fillers, and they were treated with steroids and antihistamines, and they got better. And it totally makes sense for what we see on a regular basis. This is just adding one more factor in there that's elevating the immune system. The percentages, and we went through the demographics a little bit, do represent a level of concern for me. But again, it's treatable and they can be removed if necessary. We're going to have to see as this evolves, as we pool the data. We're all about education here. And of course, I welcome people's comments. And as we pool the data, as we pool all the information, we're going to have a lot more to say about it. And sometimes with these treatments as well, we pre-treat with antihistamines. It's also why you'll see with a lot of the procedures I do, I use a lot of patients' own bodies' cell products, platelet-rich fibrin, and then adding fillers and biostimulators only where necessary. Should you get the vaccine? Yes, I'm going to get the vaccine. If you follow my plasma eyes, I'm also going to get filler. I had the 2 sessions of the PRF, and now I'm ready for a little bit of filler, and I'm going to get it, and I'm going to get the vaccine. I think risk stratifying yourself and looking at the data for the vaccine, and certainly we're going to have a lot more data as this unfolds. I feel confident in both, but we're keeping a close eye. For you, if you want to stay tuned here, as everything updates, I'm going to update you as well on this channel and on my other social media platforms. And I put a playlist right up here on dermal fillers, so you can find out a lot more about all the different fillers we talked about, so you can choose which is the best one for you and make the decisions that are best for you in your situation. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.